We are here with Adelena Marshall, who is a VA mental health RN, and she's been on the show before, always with a fund of knowledge and insights into our VA issues. Today's discussion is how VA Employee Fairness Act impacts the veterans' care and the fear of COVID-19 vaccine. Welcome, Adelena. How are you doing today?
I'm great, and thank you and Cliff Kelly and Linda Smith for allowing us to have this opportunity to talk to our veterans. Thank you so much.
Oh, thank you. And we actually had a couple of earlier shows where we were talking about this new commission that they're putting together that's threatening the sanctity of the VA system with a 9-person commission. It was actually put together under the Trump administration. I'm hoping it's one of the things that the current administration drops. But, it looks like this panel or commission is being put together about private sector usage. And one of the most efficient systems I've seen in my lifetime is really the way the VA operates. And there were concerns about, this would cost more money in the private sector and that we're actually taking a step backwards by making a move in that direction. But, what are you seeing right now with this Fairness Act and how it's impacting our veterans' care?
Well, under the Fairness Act, we're asking for removal of 7422. It allows other VA professionals to bargain collectively, but 7422 actually handicaps the VA nurses from being able to advocate for our veterans. All of us are aware of COVID and when it first started, how we didn't have enough masks, we didn't have PPEs, we didn't even have enough hand sanitizers. And it was the nurses that brought this forward. But many of our nurses are afraid to advocate for our veterans because they're afraid to lose their job. So we're asking that the VA supports the Employee Fairness Act of 2019. Is under Senate Rule number 462, and the House would be under 1133. And we do ask that all our veterans call their representatives, senators, and congressmen and encourage them to overturn that. As you know, the majority of nurses are females, and so we also look at this as a way to quiet females from speaking out and having a strong voice in the VA. Our veterans know that we're there to care for them. COVID is a big example on the nurses having a voice in the care of the veterans and encouraging them and educating them on the latest vaccines that have been offered. And we review all of these things. And if we think something is unsafe for our veterans, we want our voices to be heard. We don't want to be silenced by 7422.
Yeah. And so what is the timeline on that? How are they sort of moving forward with it? When does it come up for voting and those sorts of things?
Well, what is going on now with the Senate, we're not really sure, but the bill has been introduced as 771 by Senator Brown for Ohio, and the House bill is 1948, and that was introduced by Representative Todd Kemno for California, and that would give the RNs full collective bargaining rights. All the other hospitals in the Chicago area and throughout the country, private hospitals that have unions, they're able to bargain fully. But because of 7422, it really handicaps our nurses from being able to have a voice about our concerns that go on in the VA. Another voice that we have, and we've been speaking out very loud, is about the privatization of the VA. We want our veterans to us. We're uniquely qualified to handle PTSD, other Agent Orange, hepatitis, all of these items and medical issues that our veterans come to. And when our veterans come, we do whole health. We don't just stop because, say, you stub your toe and you're being seen for that. We want to look at you as a whole person. And you come in, if something else is wrong, we want to address that. We have walk-in care for our veterans to the clinic And at Jesse Brown, we're getting ready to enlarge our emergency room so we have more capacity to care for them. But we can't be short in caring for our veterans. The VA promised our veterans a lot, and they want to deliver, but it has to be, they have to have enough staff to deliver the care, because the veterans are coming to us and they believe what the VA is telling them. So 7422 is really handicapping us from being able to be that voice. I always look at myself as a megaphone for our veterans. And so we do challenge the doctors. We look at the medications that our veterans are taking, and many of our veterans trust us. I had a veteran the other day confide to me. He has major heart disease. Confide to me that he wasn't taking his medication at home. So I spent a lot of time talking to him and trying to show him the importance of remaining compliant with his medication so that he can enjoy a quality and a longer lifespan.
Yes.
When you get this, other hospitals, they are not going to take that time to even learn about that veteran. That veteran is like a family member, and I want to make sure that they're cared for, and so does all the other nurses. They're very dedicated to our veterans.
Yeah, I had a really, I went to one of the major hospitals, because at one point that the VA system had, so many people, and they needed to have more, given more money and get more staff, of course. But we had to, they had to sort of send me to another place for getting physical therapy. And when I got there, I had such a horrible experience at this private hospital. And it's a big name. And I'm not going to say it on the radio, but I was so glad when they finally had an opening. I went back to the VA. I felt I was in a much, much better place, and people understood who I was and why I was there and what was going through. So I totally agree with that. But it sounds like 7422 is almost like a form of censorship. And we've had so many different cases in history, where, for example, with attorneys stepping forward, Aaron Brockovich, right, with the environmental catastrophe of what some companies were doing. Right. How can you silence the voice of someone that's trying to protect, when the first duty of government is to protect its citizens and the veterans who are citizens who have put their lives on the line? How can you silence the voice of those people that will protect them when that's your job as a legislator?
Well, when you talk about disparity in health care, I have to really state that we are the first line to prevent that. We will speak up and speak out if we fear there is disparate treatment with any of our veterans across the board. So it's not just necessarily race. It could be economics. It could be mental health. It could be the environment. And so we will speak out. Matter of fact, there was a VA employee that first started realizing that the veterans coming in sick, and it turned out to be Agent Orange. So we are your first line. We are the veterans' first line, and we're committed to that. We don't look at our veterans as a dollar bill, because the VA care is free to our veterans who qualify. So we're not constricted by that. We are constricted by 7422. And so if I need to spend an hour with a veteran, I'm going to spend that hour with that veteran. But I need other staff there who can also be available to take care of the other veterans who might be waiting, for another nurse to see them. And we got a lot of nurses, even just the last 2 weeks, we've lost about 10 of them due to retirement.
Oh, boy, 10. Wow.
Yeah.
That's a lot. That's a lot.
This 7422 is very restrictive, and it doesn't harm us. It harms our voice. It makes us have to be quiet and be still. And now, in this country, is not the time for anyone who's able to have a voice to be quiet and to be still. We need to be able to have the freedom to advocate for our veterans.
Yes. And what specifically does that 7422 do? So it tells you that you can't participate in certain ways, I guess. But what does it say, specifically about what you can and can't do? Is there like a something that they are? Mm-hmm.
So with 7422, it leaves us without full collective bargaining. Management can leave VA nurses without resolution to disputes over workplace issues that endanger our patients' safety. One of those is unsafe staffing, insufficient supplies, or assignment of a nurse to a unit without adequate training. And I myself can honestly say that has happened. I have witnessed that firsthand.
Wow.
So we should be able to advocate for staffing levels, professional practice, and conduct and compensation and benefits. The RENs constantly have to voice our concern about short staffing. I can tell you firsthand of a situation where a nurse came in to work overtime because of the staffing was short. Mm-hmm. They were still short when she came in. And then she ended up with 4 patients who were full care. She had to suction them. She had to turn them. She had to clean them. She had to feed them. She had to run back and forth to make sure their medication was dripping right and everything. And we don't even have a sufficient float pool that is staffed sufficiently to cover any of, sick calls or vacation calls or anything like that. So how can we, in good faith, deliver the kind of care to our veterans that they deserve and that the VA has promised them?
Wow. That sounds like a very, very involved, complex situation, as you said. If you have 10 nurses missing, who's holding the ball, right? And they,
right.
And I know the nurses are overworked to begin with.
They're overworked, and COVID has taken a toll on the nurses emotionally, physically, spiritually, because it's hard for us to, lose any of our veterans to this virus. And it's not like somebody is sick and we can leave that there and go home. We don't. We go home. We talk about it among ourselves. We talk about the care. We talk. I had a nurse in ICU tell me she worked the whole 12 hours and was not able to leave that patient's bedside to go to the bathroom because there was no coverage to relieve her. And she did not want to leave him because he was very, very acutely ill.
That's unconscionable. Yeah.
Yes.
I just, and the VA is also doing some really great things with offering this vaccine. Now it's open to our veterans and their spouses and caretakers. And so you're your nurses are saving lives every day there, right? By just giving the vaccine.
And we advocated for them to open up the vaccine to all veterans. Before it was only to veterans registered at the VA, and we were challenging why. This vaccine is free to the community. Why couldn't our veterans come in? So they did go a step further and agreed to inoculate, their caregivers or significant others, family, wives, and whoever's caring for them. So that was I was very proud of that they did that. But we called and we contacted the Veteran Administration about having that vaccine available to all veterans.
Yeah, and then, so what do you think this toll is of everything that's going on? Because you're a mental health nurse, and right now we don't have enough mental health care providers in the general population, right? That's looking at all healthcare systems. So what do you think this toll is going to be on our veterans and their families? And is there a need to make sure that, as you were mentioning, if you can't speak up, you can't say, well, I see a shortage in some of the areas of need for mental health. So we need more funding. We need more things to come forward to make sure that we have adequate, resources in order to address our veterans' issues.
So I'll give you a good example. We have one nurse. She just became an NP, mental health nurse, highly skilled, highly educated in that area, and she's leaving because they don't have vacancies or don't want to hire mental health NPs. So we need NPs because we don't have enough doctors, we don't have enough psychologists, we don't have enough social workers. So we have NPs that have mental health training, and she has to leave, and she's going into the outside community where that skill and that experience and that education we should not be losing. Those are the kind of personnel we want to keep to care for our veterans. She has experience with our veterans, but now that experience, that skill level is going to be lost to private sector.
That is just that doesn't make any sense.
That's because 7422. We cannot negotiate her wage. They tend to be paid almost $20,000 less than private sector. So we can't even negotiate her wage. We will never be paid with private sector. If you come into the VA, you're coming there because you want to care for these veterans, because certainly if it was paid, then a lot of our personnel would go someplace else. But when you're expected to work at a $20,000, $20,000 pay gap, that's asking a lot. Our nurses are there because we want to care for our veterans.
Yeah, and I'm a doc myself, a physician, but my nurses take care of me. They keep me keep me going, keep me alive and breathing, and I'm a veteran. Right. And so, how can our veterans and actually even their spouses and their caregivers get involved in this whole issue about the 7422? Is there a website they can go to or find out more information about it and get involved, call their legislators, do something?
Well, they can go to National Nurses United's website, but they also can call their senator and make it easier, and their congressman to call and tell them to overturn that bill and to vote for Bill 771 that's in the Senate, and in the House bill is 1948, and Bill 771. So they just need to call. They can call Danny Davis' office. He's on the Veterans Affairs
Committee, yes.
Yes, and whatever area, and we need everybody, not just veterans, but the friends of the veterans, the families of the veterans, because as private citizens, these veterans is our responsibility to make sure that they're cared for. They have fought for us, and they have actually fought wars for other countries to keep them safe and then give them rights the same as we have. So this is really a U.S. issue for every U.S. citizen should be calling in and asking them to overturn that bill.
And that's in the House now, the 744?
It's in the House, House Bill 1948. 1948. That's birthday year for many of our veterans. And the Senate Bill 771. 771 is the Senate bill. And
you want to support those two?
Yes.
Yes, because they sort of rectify the situation, I guess, right? They sort of go in a different direction.
Right. As everybody knows, the VA nurses, we don't have a right to strike, nor would we. We would never interfere with any delivery of care to our veterans.
Right.
So the only voice we have for them is the areas that we are advocating for, and that's for our veterans.
Right. Yes. And God bless you all for what you do. The nurses have been champions and warriors in this storm that we're going through with this pandemic. But they're always there, right? Even before the pandemic. And
they're there. We don't watch the clock. We're here until we have made sure that our veteran is cared for and that care is completed. A lot of nurses leave late because they say, Miss Marshall, we're still charting. I couldn't leave because this happened. And
right.
We understand that.
That's right. And doing it out of the goodness of their heart, because their clock ended, but they still they're putting time in that is part of compassion.
They're still putting time in. You may not even have somebody to cover your shift. So you're going to stay there until they can find somebody or pull somebody from another area, which in turn make that area short-staffed. So 7422 has got to go. It is not protecting our veterans. It is harming our veterans.
Yes. It sounds like it's not even protecting the staff, right? Our healthcare providers that are there. our nurses.
It's not. It's not. Yeah, it's not.
Yeah,
we cannot lose the experience that our staff has gained to the private sector. And believe me, the private sector wants our nurses because they're trying to get the veterans to come to them. And they know they're not prepared to care for them. But if you can pull the staff away from the VA, then, they feel that they'll have a better chance. But we want that staff to stay there. We want them to remain and to care for our veterans.
Yes, yes. And, and that's something that I was mentioning earlier that, I've gone to the, private sector, of course, for different healthcare needs, and I never have the same feeling that I have as when I go to the VA. I feel like I'm with family when I'm with the VA, and that they really actually genuinely care about what I'm going through or what I've seen or gone through. Yeah.
The VA welcomes all vets. I'm not so sure that there'll be some of our vets would be welcome at some of the more renowned places, wherever they live at, because some of our vets really have hard times, and they have hard time in trusting people. They trust us. They come there. Many vets who are homeless will come to the VA because they feel safe there. They know we're going to take care of them. We're not going to try to call the police on them and things like that. We're going to sit and talk to them and figure out how we can assist them and even assist trying to get them housing.
Yeah, it's a national tragedy not taking care of our veterans. So go against that House Bill 7422 and vote for Senate Bill 771, House Bill 1948. Thank you so much, Adelena Marshall. You are a mental health RN extraordinaire. I'm glad you're in the fight. So we had to thank our National Nurses United. Google that name to get into the website and support their effort in defeating this House Bill 7422.